Dubai is the one that have the highest concentration of plastic surgeons, I think, in the world.
In the world, yes.
So even more than California.
Barbie, perfect, now.
Do they bargain? Do they ask cheap? Cheap?
Yes.
Barbie now?
Yes.
Yes, exactly.
Oh, you're looking for a female surgeon? I just know a very good one. That is my wife.
So you help each other?
But doesn't exist any school of plastic surgery in all the Gulf regions.
The young generation, they're open-minded and they say, okay, if I could do different kind of procedures, I will do it with pleasure.
If you do a bad one, you burn yourself like the bridges, yes.
Wow.
So it's a tough word.
Cut. Yeah, only the surgery.
It's
like Google.
experience. Exactly. Home Google.
Mario Google.
Exactly. MarioGoogle.com, exactly.
Yeah. Chiara and Mario, so I'm so happy to see you in Moscow. I know this is your first time in Russia, and it's the first time in my practice when I'm taking interview from a couple who is the boss of plastic surgeons. Now it's very important questions. Somehow you decided to move and try yourself in Arab Emirates. Could you tell me why did you decide? Why? Or was it request from the Arab Emirates? They were looking for young doctors who could, let's say, develop breast reconstruction surgery in the country, or you just say, okay, I would like to try myself in a different field, in a different environment with a completely different mentality and different patients. What was your trigger?
So basically, it's all of this that you have just said, because it's always a combination of different factors. We were living a very good moment of our life because we just decided to get married.
Yes. It came as unexpected, to be honest. It was not something that we planned.
No, but
So did somebody catch you and say, oh,
Yes.
wow.
yeah,
Yes.
yes.
So in two different ways, exactly.
exactly.
Mario to build and to create the microsurgical service in the Cleveland, Abu Dhabi, because the history, they started 8 years ago, but there was never a constant, a reconstructive person doing 360 all the reconstruction about everything basically. And for me, they were looking for a female plastic surgeon because, in the governmental hospital where Mario is working for cancers and everything, the patient, they don't choose, and also they don't care if the doctor is a male or a female, because they have something to treat and they want the best treatment.
Okay.
For elective cosmetic procedures, they want a female. And if not the patient, the family wants the patient to have the female, like for daughters or for wives and everything. So it's the demand is very high.
That's the lucky thing, is that we are working 2 different clinics, 2 different hospitals. So I just say, oh, you're looking for a female surgeon? I just know a very good one. That is my wife, actually, and I can recommend.
So you help each other.
Yes.
This is a good.
Yes,
this
no,
is a
it's
good.
nice.
So, but tell me again, you don't have a competition, like you think that you could do this case better than your wife, or you never discuss it?
No. We discuss a lot about work, to be honest, and we share especially for difficult cases or for complication. It's really relieving having someone that you trust and who has experience.
Like Google.
Exactly. Home Google.
Mario Google.
Exactly. MarioGoogle.com, exactly.
Yeah. Coming back to this Arab Emirates, tell me, what is the stage or level of their aesthetic and reconstructive surgery medicine? Because we know anything. We know that they have something. We know that some Russian doctors, they get the license and they do surgery, working as a plastic surgeon in Arab Emirates.
Yes.
So
in general, we don't know much about this.
Okay, so let's say that there is an incredible numbers of plastic surgeons, in particularly in Dubai. You know that the United Arab Emirates are seven different countries. When you get your license, you get for that emirate, not for all of them.
Okay.
Dubai,
Just for one.
Dubai is the one that have the highest concentration of plastic surgeons, I think, in the world.
In the world, yes.
So even more than California. So it means that there are incredible numbers. There are many plastic surgeons or people who qualify themselves as it. So it means that you will find an incredible variability of people. So there are definitely a very good level. In cosmetic, definitely there are so many things that they are doing, so many people and good colleagues. However, when you have huge numbers, you will also find someone who maybe is not that high level qualified.
Yes.
So you will see a lot of different things.
The other thing,
Me?
no, even the patients, I mean,
Patients.
it's difficult to create your niche in Dubai because there are so many alternatives that even if a patient is happy with what you did for her, like breast, since the friend went to this, so they go for one to the breast, another for the tummy, another for the nose. I mean, like, they don't stick with that surgeon. They kind of they go to different type of doctors. While in Italy, for example, if the patient is happy, they continue the whole experience with the same doctor. Same thing in Abu Dhabi, to be honest. In Abu Dhabi, the patients are more like there are less plastic surgery. It's a bit more difficult to have the license there. So yes, they're quite more, like, I would say selective, but even the exam and everything is tougher than Dubai.
But
And
it's in English language, yeah?
English, yes. For me, I'm operating mainly on local patients in Abu Dhabi, while Dubai are expats and mixed. The local one, they speak little English and almost only Arabic, but I have my assistant, which is like giving me a perfect translation, and I can do some basic Arabic. The patient, they have extremely high expectation. I think they're one of the most difficult kind of patient to deal with, yes. Because they want, like, you hear these three, like, say, I would say sometimes red flags: Barbie, perfect, now. So you have these three things in a sentence.
Do they bargain? Do they ask cheap? Barbie now?
Yes, exactly. So
it's really
it's interesting.
They bargain for the price?
Yes.
With you, because with you
With
they
the
could not
assistant.
bargain. It's
With
a fixed price, probably.
Usually it's
with
a
that,
fixed price.
with the assistant, because for us we don't give the price, so we can keep but it's part of the process.
Part of the game.
Yes.
Part of the
It's
game.
part of the game.
And then at the end, do they pay a sort of extra honorarium to the doctor, or
No, they pay what they have to pay, but they bring gifts. They're very grateful, like even small or big things, but they get to, and then they send, whenever they're happy in Abu Dhabi, I'm talking, they not only keep on coming back, but the whole family and the whole neighborhood starts to come. So it's like you can either raise like your career and your name in a very
if you do one good surgery, then
exactly.
whole
the
family
family
Same thing if you do a bad one, you burn yourself like the bridges. Yes.
Wow.
So it's a tough word.
So what is your general plan, if you have any, to stay in Dubai for a couple of more years? Yeah, is it?
At the beginning, the plan was 1 year. Now it's already 3.
Okay.
So we are going year by year.
So the point is, what I always say to my wife, whatever plan you do, you don't know in the life. So definitely we are enjoying the moment and try to get the best. And then we'll see what happens.
In terms of mentality, also maybe a strange question, they would like to go to the foreigner, or they would like to go...
They prefer.
They prefer.
They prefer.
That's why you have chance to stay forever, because they will choose international doctors.
They prefer foreigners and Westerns in general. Then when someone, even we have a few very good Emirati colleagues or from the Arabic world, and they're very busy. But as preferences, they may, like, if they had to choose, they go to the Western doctors.
We are trying to develop, one of the things of my hospital, we are trying to develop the plastic surgery residency to train locals people, or people who are coming from abroad, and to become plastic surgeon, because we have the highest amount of plastic surgery in Dubai, but doesn't exist any school of plastic surgery in all the Gulf region.
So how do they
They can go abroad. And so the idea is, because we are trying to get a very high quality level of reconstructive and cosmetic, trying to train them in there. And that's a project of the future that we are doing there.
Because I know that also you are young generation, and young generation of the plastic surgeons, you are very open-minded. So what does it mean for me? That I know that you combine also cosmetic procedures,
Yes.
which is, for instance, if you will talk to the old generation of the Russian doctor, they will tell you never,
No.
ever in my life, cut, only the surgery. So the young generation, they're open-minded and they say, okay, if I could do different kind of procedures, I will do it with pleasure.
Yes.
So what is your balance between surgery and aesthetic procedures, which is, I think that you do hyaluronic acid injection, the collagen injection, the threads or not?
Threads I
But
don't
not.
do. Not you do?
The
No.
point is, depending how the people, the patient, are coming and expecting to be treated from 0 to 10. So trying to give all the different offers and meet the expectation. And so if they are asking for hyaluronic acid, or if they need any preparation treatment for
In
any
hospital,
cosmetic.
I
mean,
or if you are working in a private hospital.
no,
for the,
in my hospital, all the cosmetic procedures
Also.
are done inside. Yes.
Interesting, because in Russia it's
Even in Italy, it's
Exactly.
like that.
Even
You
in
have
Italy.
to separate the
yeah.
things. Yes.
But the same doctor can do it in Italy.
Yes. In Italy, yes.
And so that's why many of us has knowledge about even injectable, etc.
where did
So-
you study this injection? Because this is a different field. In Italy?
Yes. Because in Italy, mostly of young plastic surgeons do indeed.
No, but even not young. In Italy, it's
No,
Yes,
it's-
exactly. Not even
Yeah.
young.
In
exactly.
Italy, it's more on the plastic side. In the Emirates world, it's more on the
Dermatologic.
dermatology from the dermatologist. So even for me, but I think even for you, Mario, let's say that in the practice, 20% are injectables or non-invasive procedures, and 80% is surgeries. And the patients, for me at least, they come for injectables and everything, but they mainly are my surgical patients that remains with me to
Yeah,
continue
exactly.
the non-invasive treatments, because otherwise, as mentality there, they go to the dermatologist for all this. So the plastic surgeon is for surgery, the dermatologist is for injectables. So there are these two worlds.
Maria, and what do you think about the future of the plastic surgery?
Oh, that's interesting connection. So as I try to always to say when I gave the presentation, really changed a lot in the last 20 years because a lot of new development and even the changing of mentality from pure reconstructive, pure cosmetic nowadays. So there is all more interaction between the two of them. So I just think that the future will be more exciting because new products, new devices, new technologies, and all of these are going to increase and to have a more harmony in the results. It's important to have all the different tools in your knowledge and give the best treatment for your patient in every time that he will come. So we'll see.
The artificial intelligence could be like something useful, but at the same time something very dangerous, because nowadays I receive my patient, like maybe they have, after surgery, they know they are expecting swelling and everything, and they chat with ChatGPT. So, and then they send me the screenshot.
ChatGPT gave me this kind
Give
of
me this nice.
suggestion.
I may have a lymphoma.
Could you do it?
I may have a lymphoma after like 5 days. I said no, it's impossible. So they come like I was chatting like no, don't chat.
So,
Yes.
But in general, what do you think? Because you're a young one, do you think that in the future we will be only doing cosmetic procedures, the surgery will go, like cancer surgery will go down to the chemotherapist, or artificial intellect will
I think-
replace plastic surgery?
No, but I really think that there will be more and more overlapping of the two things. So it will be not just breast reconstruction, it will be a cosmetic reconstruction. We're already doing a lot of trying to get the best cosmetic results in every reconstruction, and it will be more and more overlapping. Trying to minimize, do the abdominoplasty, lipoabdominoplasty, nice shape of the abdomen, and use this tissue to do the breast augmentation with less scar. So that's absolutely what I see in the future. There will be less and less distinction between reconstruction and cosmetic.
You are the first time in Moscow,
Yes.
and first time on this Moscow breast meeting, which is number 9.
Yes.
So what is your
Invitation.
impression?
it's amazing. It's super organized, and it's amazing how interactive,
case.
and there is exchange of opinion, like honest opinion. Nobody's judging nobody, and everybody's showing their best cases, but also the worst cases, like what went wrong and everything, without like because usually everybody likes to show only the best ones,
best,
and for
yeah.
sure. And this type of topics and meetings, they really give us something so to think about, to discuss, and it's really high level.
Yeah,
Yes.
thank you.
Totally agree.
So, okay, next year we will be doing, it will be number 10, and we want to do something special. What will be your suggestion? What do you think that we need to talk about during this Moscow Breast meeting to make a good impression on the auditorium?
Hi, this maybe
Because you are young one,
yes,
so
Yeah.
for young,
I'm thinking maybe next like new perspective, something like that, like to
Yeah.
compare like tradition and new challenges.
Yeah.
It could be even nice to have like the confrontation between like the old school and the
okay.
Yeah.
young school. Like some of these could be
So boxing
and I-
session, old school,
like
Box
this
school and new school.
versus new approaches or something like
yeah.
that.
See how the breast surgery had changed in the last 10 years.
Yeah.
So because it was 10 years of evolution, feeling from old school and new school, because really we have new devices, new technologies. So see how was in the past, how will be in the future.
Okay, thank you very much. I hope we will do something special with you for the next course in
We hope to.
Oh,
We
you
boxing
so.
session.
Thank
We
you
are
very
young
much.
versus old
honored.
school.
Yeah.
Thank you very much
Okay.
for the
Thank you, Olga.
invitation.
Thank
you.
Really, thank you.